Hi friends, I brought a new medication for you. It's Claritek Clarithromycin 250 mg. This is a medication from Getz Pharma, which is a multinational company. This box has 10 tablets in it, and the cost of the box is 300 rupees. Clarithromycin is used to treat certain bacterial infections such as pneumonia, lung infections, bronchitis, infections of the tubes leading to the lungs, and infections of the ears, sinuses, skin, and throat. It also is used to treat and prevent some other infections of the lung. It is used in combination with other medications to eliminate H. pylori, a bacterium that causes ulcers. Clarithromycin is in a class of medications called macrolide antibiotics. It works by stopping the growth of bacteria. Antibiotics such as clarithromycin will not work for colds, flu, or other viral infections. Taking antibiotics when they are not needed increases your risk of getting an infection later that resists antibiotic treatment. Clarithromycin is also Clarithromycin also is used sometimes to treat other types of infections, including Lyme disease, an infection that may develop after a person is bitten by a tick. Cryptosporidiosis, an infection that causes diarrhea. Cat scratch disease, an infection that may develop after a person is bitten or scratched by a cat. Legionnaires disease, type of lung infection. Pertussis, a whooping cough, a serious infection that can cause severe coughing. It is also sometimes used to prevent heart infection in patients having dental or other procedures. The side effects of this medication may include diarrhea, nausea, vomiting, stomach pain, heartburn, gas, change in taste, headache, etc. The normal dosage for this medication for acute sinusitis is oral tablet 500 mg taken every 12 hours for 14 days. In children, the recommended daily dosage is 15 mg per kg per day. It should be given in 2 daily dosages, one every 12 hours for 10 days. And the dosage depends on the illness and the severity of the infection. This medication can be used as an alternative for treating infections in the patients who are allergic to penicillin. I hope you like the video. Please share and like our channel. Thank you very much.